Good afternoon, everyone. I'm Kathy Rock-Duquet, CEO of Blue Star Families. Thank you so much for joining us today at the final hour of our annual Military Family Lifestyle Survey Results Release event. Our applied research team is excited to dive into the data with you. If you joined us earlier today, thank you for that. If you joined us yesterday, we're very happy to see you back. If not, all of the material is available on our website. We'll be dropping that link in the chat, and we ask you to explore it. We are thrilled to welcome back our friends and partners at the Daniello Institute for Veterans and Military Families at Syracuse University. They are our partners in this research. They're here to also help answer your questions. Moderating the next hour is a wonderful friend of Blue Star Families, Rob McCartney, the CEO of the Barry Robinson Center. Rob oversees this 72-bed residential treatment center, a really unique facility whose primary mission is to help military-connected children and their families to heal.
So is that my cue?
Yes, Rob, we're so happy to have you with us. Thanks for joining.
Well, thank you. And welcome everybody to this deep dive. It was pretty exciting to watch yesterday and also this earlier this afternoon about the data and the communication. And I anticipate you guys to also have same type of questions. So let's get going on this. The purpose of this deep dive is to provide some additional data around each topic. The research team selected a handful of data points to spark the discussion amongst our panelists during yesterday's panel titled Back to Basics, Military Family Health and Mental Health. But there is so much more to share. In this data dive, we have three goals. One, present some additional data relevant to the discussion from the previous session. Two, answer questions about the data or the findings. Three, provide you an opportunity for further discussion. Because this is a live session, the research team will do their best to answer your questions, but some questions will require some more digging, and they may not be able to provide an immediate answer. If they are not able to provide a response in this session, they are taking notes and may be able to provide a response in a follow-up email. I want to note here that the research team might not be able to answer all questions. The data may not allow it. Often when they drill down to very specific groups, the sample sizes are too small to responsibly report. Your questions, however, can provide some direction for future survey iterations. Inevitably, answers to research questions provoke more research questions, but an annual survey allows them to continue that research conversation in subsequent years. Before we get into the deep dive, I would like to share that the Blue Star Families next survey launches on May 23rd. We hope that you will help us share it broadly so we can continue this work. All right, you guys. So with everything, there's a few rules. So there's 4 of them. Number 1, to ask a question, please type in the chat. We have several team members who can respond to questions in the chat or direct them to the attention of the facilitator. Number 2, please be respectful and considerate when framing your questions. We will remove vulgar, inappropriate, or inconsiderate participants. Number 3, we know that these stats are not just data points, but reflect real people's real lives. They can evoke stories and memories of personal experiences. We welcome your experiences, and if you would like to share your story, BSF would love to connect you with their storytellers. Finally, as you probably noticed from the Zoom pop-up, I am providing another friendly reminder that we are recording this session. Thank you again at this time, and I'd like to pass this off to my friend, Dr. Kim Hunt, to give us an overview of the findings. Dr. Hunt.
Thank you, Rob. This is a great introduction and a great beginning to our second deep dive today. Thank you, everybody, for joining us. We have our great team of our applied research team from Blue Star Families and our friends at IBMF who are in the chat. So please make sure you add in your questions there. We're going to do the data deep dive this afternoon on health and mental health. And we'll be starting with talking about our family building finding. So our family building finding is a new topic for this year. We had some great SMEs that helped us with this, our subject matter experts, and we were able to get some data on family building challenges for our military families. So the first thing that sort of struck us, we had 64% of our active duty family respondents reported that they had challenges with family building during their lifetime. And over 4 in 10, so 42%, reported that the military created challenges to having children, specifically the desired number and or spacing of their children. Half of active duty family respondents who report they or their service member was assigned to Special Operations Command indicated the military created challenges in family building compared to 42% of their non-SOCOM peers. Just as we saw differences in their SOCOM peers, we also saw differences in female active duty service members and female veteran service members. Those female active duty service members reported 57% that they had challenges due to military lifestyle, compared to 28% of their male active duty peers. And then the veterans, it was 30% for the female veterans versus 19% for male veterans. And then more than half of our LGBTQ plus active duty family respondents also reported family building challenges due to military service. The challenges are a piece of the story, and part of these challenges that we asked about had to do with whether they had problems with building their family in multiple ways. We asked about different challenges such as fertility and hormonal imbalance, but also we asked people about their experiences with adoption. And so it covered multiple ways that people build their families. And active duty families over and over again cited that they had paid out-of-pocket expenses that were associated with their family building endeavors. Actually 77% of the active duty families said that they had some out-of-pocket expenses, with 1 in 10 spending over $35,000. And while these stats are very impressive data that we've been able to collect from our respondents, we were very humbled that 1,600 respondents shared their stories with us. We asked in an open-ended question if people would be willing to share their stories. And they weren't just willing, they went out of their way to share with us what they had done. And many of them had mentioned their out-of-pocket expenses, but one quote in particular struck all of us here on the research team. And that was one of our spouse respondents had written in that they had incurred quite a debt to build their family. And each month that they wrote the check to pay that debt, they were reminded of the failed IVF treatments and that they still did not have a child. And that really hits home, the sacrifice. Time away is a big issue for everything for families. For those who were building their families, in order to get treatment for infertility, you need to be together for 12 months. And as we know with military families, that is not always the easiest block to check. So speaking of time away from families, we had 81% of our active duty spouse respondents experienced at least one separation from their service member due to military obligations in the past 18 months. And of those who note being separated from their service member at some point in the past 18 months, a third have not experienced any separations longer than 1 month, and 28% report one separation. However, 39% have experienced multiple separations longer than 1 month in the past 18 months. Active duty spouse respondents who were separated from their service member reported higher mean stress scores than those who were not currently separated. That's not surprising to all the military spouses who are out there and their service members, that a lot more responsibility falls on the spouse when the service member is not at home. We also were able to take a spotlight look at National Guard and Reserve. We're very thankful for our National Guard and Reserve families for responding to our survey. We've been building those numbers each year, and it's really great to hear the experiences for all of those families as well. And time away from family was once again the top military family life issue for both the National Guard and the Reserve family respondents, 42% and 41% respectively. More than half of our National Guard family respondents, 55%, and 40% of our Reserve family respondents report they or their service member were activated during survey fielding from April to June 2021. These are huge, unprecedented jumps for our families that are part of the National Guard and Reserve. Most, 63% of National Guard family respondents and 54% of Reserve family respondents had experienced at least one military connected separation lasting a month or longer in the past 18 months. And 1/3 of National Guard family respondents and nearly a quarter of Reserve family respondents had experienced 2 or more separations. So we're seeing quite a bit of separations in our families, and we were very happy we were able to create a spotlight. So we hope that you look at that in our comprehensive report and read through it to see what their experiences are. We touched on this a little bit in the last deep dive and in the beginning here. We wanted to take a look at spouse well-being. Spouses are the backbone of many of our military families, and we wanted to just take a special dive into where the spouses are at this point in various different factors. We did find that fewer than half of our active duty spouses reported that their health was excellent or agreed that their health was excellent. And 2/3 of our active duty spouse respondents, 67% reported they did not have a current mental health diagnosis. However, 25% did report that they have a diagnosis of general anxiety disorder, which is much higher than the overall civilian population. Similar proportions of active duty spouse respondents who report they were separated from their service member due to deployment, 38%, TDY, temporary duties or training, 36%, or geobaching, 33%, at the time of the survey fielding, agree they get enough sleep to function effectively, than those not separated at 42%. So it's not huge proportions, but there are differences when your spouse is gone and the sleep levels that the spouse who's at home is getting. 1/3 of active duty spouse respondents with children at home, 39% agree they get good enough quality sleep to function, while half of their counterparts who do not have children at home feel the same. Of those who responded to our open-ended question, what's preventing you from getting enough sleep to function effectively? The most commonly cited reasons were stress and anxiety, physical health related reasons such as chronic pain, and parenting responsibilities. Good news is that our children are thriving in school. We asked our active duty respondents who reported they had a child in K through 12. We asked about their oldest child who is in K through 12. And 61% report that their oldest child is thriving in school. And 54% report their oldest child feels a sense of belonging to their school. Active duty family respondents who report their oldest child is thriving in school are significantly less stressed than their peers who do not believe that. The numbers for sense of belonging, we looked a little bit this year at the number of school transitions and a sense of belonging. And the more school transitions that the children had, the lower their sense of belonging was within their school. Education modality and thriving. We also looked at thriving by education modality, and a greater proportion of those active duty family respondents whose oldest child received in-person instruction reported their child was thriving at school than those whose oldest child was receiving virtual or hybrid education delivery for both oldest children characterized as grade school, 6 through 12, and adolescents 13 and older. What's interesting here, and you can sort of see this on the chart, is that the adolescents did better, or not better, but they did worse in the virtual than their younger peers. And part of that could be because of some of the qualitative answers that we got with how their children were doing this past year, especially considering the school close downs from COVID and then the back and forth and the hybrid. And so what what these people were telling us was the adolescent children that they had, who were the oldest child in school, they were really missing out on the social interaction with their peers. And that seemed to really impact their ability to thrive in the virtual and online environment. Whereas for the little children, the hybrid was more difficult, the sort of back and forth. And that kind of goes to the idea of the constant changes, the changes in schools, the frequent PCSs, and that the constant change is harder on the little ones. But with the adolescents, they were able to have at least some time with their peers. And so they seemed to do a bit better. And that's, at least that's what the qualitative had told us when we looked through that. We also looked at virtual education delivery and the different modalities of education delivery for children's mental health. We were able to take a little deeper dive this year into children's mental health. And despite the considerable concern that the method of education delivery was impacting children's mental health, there were few notable differences in the perception of their older child's mental health between those who report their oldest child was in virtual education, in person, or hybrid. Although, as we mentioned before in the previous slide with thriving in school, the adolescent oldest child generally reported lower mental health than those with grade school age oldest children. And as I mentioned, our respondents who told us in the qualitative open-ended how their children were doing, it was primarily their older children, their middle school to high school age children, who were having more difficulty with not being able to be social with their peers. Overall, military children's mental health. Overall, most of our families report that the mental health of their child is good or excellent, averaging a 3.93 on a scale of 1 to 5, whereas 1 is poor and 5 is excellent. A notable proportion, 43%, however, rate at least one of their child's mental health as fair, poor, or very poor. And a small proportion, 5% of active duty family respondents, report their child has expressed suicidal thoughts in the past year. Among active duty family respondents with children, a pattern of decreasing good and excellent mental health ratings by the age grouping of the oldest child indicates the older children may be experiencing greater challenges than their younger peers. And as we've mentioned with the changing education, the past 2 years of COVID have also been very difficult for many of our children. And some of the changes and the challenges that they've gone through have also impacted those who were already struggling with mental health issues. While it is not possible to determine the direction of the relationship, a weak to moderate negative correlation exists between children's mental health rated by their parent or guardian and the active duty service member or active duty spouse's perceived stress. In other words, the poorer the parent or guardian rated their children's mental health, the more stressed the parent or guardian reported they were. We're not sure which direction that is, but they were definitely correlated. So what are some barriers to obtaining care? So 17% of our active duty family respondents report that their children do currently receive mental health care. However, another 17% report they would like their child to receive mental health care, but they currently do not. We ask about a lot of the community resources that are available to our military families. And behavioral health services in the local community are among the lowest ranked community services for active duty family respondents. Nearly a third of active duty family respondents rate behavioral health in their community as inadequate. They also, the top reasons for not receiving mental health care, we touched on this a bit in our last deep dive. 38% believe that telehealth mental health care would not be effective for their child. Another 30% cannot find an available provider who will treat their child. And if you notice, we have one of the stats in blue, and this has been something that has come up quite a bit in Qual and in other organizations, is that sometimes the parents are concerned that a mental health diagnosis is going to prevent future military service for their child. So impact of separation on children's mental health. among military families who were not separated or who were experiencing deployment at the time of survey fielding, the family mean for children's mental health is higher, an average of 3.96 on a scale of 1 to 5, than among families experiencing temporary separations or other military-related separations. What was interesting is this mirrored what we saw with the spouse wellness, that it wasn't necessarily the longer term deployments. It was the geo-batching and it was the temporary trainings, TDYs, that actually showed a lower mental health mean score than did the longer term deployments. And now we are ready to take some of the questions that you
Well, Kim, let me jump in right here. And I do want to say a friend of Blue Star has joined us. Captain Ellenberg is on the phone. And just to guys, let's know, Captain Ellenberger is the Director of Incident Response Modeling and Analytics in support of Chief Data Analytics Office. Pretty impressive. And so I want to welcome you, the Captain, and the stage is yours. Or maybe not.
No, hi, sir. It just, I was getting guidance from the facilitator on unmuting, so it was
Well, welcome,
occurring
Kathy.
while you were speaking. I apologize. Thank you for allowing me to join. I appreciate it. And I think that the biggest thing that I would just offer before the floor is opened up to questions is that the military service organizations and the veteran service organizations, and particularly Blue Star families, play such a key and important role in collecting data. I think that there are, everybody has different incentives, and I think the intent of the MSOs and VSOs is purely to support our families, and I really count on the raw data and the statistical analysis that they provide so that it can help inform the department on where pain points may be and help me ask better questions and look at data a little bit differently. So thank you to all of you, and I really appreciate listening in and being able to join, and if there's any questions, open to those as well. So back over to you, sir.
Well, thank you, Captain, and thank you for joining us. And I think those of us here agree that we want to make good decisions, but we want those decisions to be made by being informed by really good data and a good analysis of the data. And I think the collecting the data that Blue Star family did and continues to do is very helpful. So, I'll start this off with a question, but before I go on that, Dr. Hunt, as I was reading the report last night, right? And you guys, if you haven't read the whole 100-page report, please do so. It's a ton of information in there, and take notes. What struck on me is the two things that came out of me. One is what I continue to hear when I go to meetings about, military recruits an individual and they retain a family, right? There's a big move on that. And then the other thing that I wrote down that friends of mine continue to tell me, embrace the suck, right? So you're right. So that the juxtaposition on that. So I think as we're talking about this, I know a lot of folks listening to me understand what that means. But one thing jumped at me right away was, why just the older child on this data collection? Why not everybody? Why not my 5-year-old?
The mental health questions we did ask for each child within the family. The education questions asked about the oldest child. That's been what we've asked about for years. It's easier for analysis on the back end. Asking about each individual child is, you ask our friends at IVMF, is very difficult for the analysis pieces.
All right.
But we did. So those mean scores that we mention in our data are actually mean scores for the entire family. And that's also why we were able to look at differences in the school modality by age, because we asked about each one of those age groups. So that was actually a very helpful a way to look at some of the data this year. Jess, I can see you leaning forward. Do you want to add something to that?
I always appreciate that. I have no poker face whatsoever, so you can definitely tell when I have something I want to add. Yeah, so Dr. Hunt brought up a great point that we were able to look at children's age this year, which is something that we haven't really done before, but that allowed us to look at the differences by age, which was really important when we're talking about children's education and children's mental health, because it is so different for adolescent children than it is for Rob's 5-year-old. That's a little bit of, they've had a different experience over the course of COVID. So it's important to consider that as we're looking at the groups as a whole. We have all of that data collected, but as Dr. Hun said, it makes it a little bit easier for the analysis when we break it down by just one child, so that we know this child is going to this type of school, this child is this old, so that we can, it gets harder to put all of that stuff together. But when we did talk, we do have some family mean scores in our findings this year, and family mean of child mental health sounds a little complicated, but what that means is it is the parents' rating of each child's mental health in the family and that average together. So if I have 3 kids that are 8, 10, and 12, I give a rating of mental health for each one of them. And then the family's child mental health as an average is the family mean of child mental health. So I wanted to bring that point up.
Questions out there, you guys type them in so they can have an opportunity to answer. You know, one of the things that struck me too, as I was reading the report and listening yesterday and today, is that sense for so many of our spouses who are staying home, the sense of isolation and loneliness. And what really caught me was not a piece of data you report on this, but it's in the report about the sense of the fact that the community, the active duty spouses do not feel supported or engaged by the community. Can you talk a little bit more about that?
That's actually at the core mission of Blue Star Families, is to connect the military families with their community and the community with the military families. It's a two-way street. And so one of the things that we try and do is make sure that families feel welcome in their community. And we have our Welcome Week coming up again this fall. And that is one of the things that's most important, because military families do go in and out of a community very quickly. And so trying to make those connections is difficult. And there's organizations like Blue Star Families out there that try and connect families together. Military families are also very much an informal network amongst themselves and also provide support to one another. But you're right, that is a very difficult issue, and it's one that is an ongoing one. And I see Jess again Dr. Strong trying to come in, and like she really wants to say something. So I will pass that over.
I was, so that is a downfall of the glass face, is I was actually trying to pull all of the questions from the chat, but let me ask one that came from the chat from Rebecca, and then I will pass it back to Rob to continue to facilitate the conversation. Rebecca asked whether we broke out EFMP families in this data, and I wanted to give you an opportunity to respond to that.
We did not break out EFMP families in this data. If you remember, our 2020 MFLS survey was done just 6 months prior, because we had the pain point polls during COVID. So we didn't take a deeper look in the 2021, but we will definitely come back to that in 2022. If you remember, in 2020, what we found was many of our families with children in EFMP, or particularly looking at education, those with an IEP or a 504 plan, they didn't have access to a lot of those supports when schools were shut down or other facilities and support services were shut down. And so we certainly want to come back and take a look at our families with special needs. And I also saw one of your questions in there about chronological age versus, versus a child's maybe mental age or ability to comprehend whatever that they may be on a different scale. They may not be equal. And that is actually a really great question. And I think that there is a way that we can work that in to a survey in the future. And I think that would be very interesting and very informative. It does get to where the ends become very, very small sometimes, and it's hard to do deeper analysis on that. but it's actually a very good question, a very good point. Thank you for that.
So thanks, Dr. Hunt. There was a question that came up and said about the I'm looking up, I have another screen. National Military Family Association did a very similar survey, and they came up with some other data that can sound like it's not consistent with what you found. Can you talk a little bit about how sometimes when you're investigating data can be a little bit different, but still pointing at the same type of problem?
Absolutely. First of all, respondents are different. That's above and beyond the primary difference. And so out of our 8,000 plus respondents, we don't know how many of those may have taken the other survey. And our audience is different. Our audience is the adults and the parents in the family reporting on their children. The other differences are the questions you ask and how you ask them. Those can give you, even if you're answering the same, for the same child and the same situation, how you ask that question can lead to different interpretations as well. Data is very, very interesting, but we try and be as clear as possible when we report and show this is reported by the parents, this is self-report data. So Dr. Strong, you want to add?
Yeah, I love the Bloom and NMFA report that came out. I really appreciate their work. And one of the things that I think is important, especially in this space, is that we can build off of each other's work, and we don't always come up with the exact same thing, which is actually a good thing because it means that we are looking at things from different angles and we're able to triangulate and sort of see what the real issue is. This happens when we look at spouse employment data. Sometimes our numbers are a little bit different from some of the other organizations that study spouse employment. And it means that we're looking at things from different angles. As Dr. Hunt mentioned, we have different samples. A big difference between our survey and Bloom and NMFA's survey and report is that they ask kids themselves. We are asking parents to report on their children. So it's a different perspective, a different sort of sample, but it gives us multiple ways to look at the same issue. We know that there is an issue around military kids' mental health and just kids' mental health in general right now. So looking at it from all the different ways that we can, from the parents' perspective, from the kids' perspective, from different samples, is important to give us a true idea of what the issue is and how we can address it. So
it's
you.
Interesting too, because regardless of what the numbers show, your data showed 17% were in treatment, 17% wanted treatment. So that's 34%. And the other one was showing 85% had mental health issues or were at risk. So even when we're talking about 35 or 85%, it's a significant issue that's got to be addressed. And it ties into a question that was asked about access to services and about that, how long is the wait? And then the challenges when you PCS, right? You develop a good relationship with a therapist and then moving forward and accessibility on that. And I know that that is an issue that's addressed. And we've been working with GHA as far as, TRICARE reimburses poorly and it takes forever to get. So there's a different issue with that. If we can pivot for a second, and there's a question up there that was asking about family building, and could you do a little more discussion on that? I'm looking for the question. Partners promise. Here it goes. The family building survey is so impactful. 2/3 of families having trouble building their families is shocking. Could you dive into more of access problems?
We did talk about it a little bit more in our full comprehensive report, the access problems. One of the things I did want to mention about family building is sort of exploratory. There has not been data like this collected in this way on family building challenges in the military community. And so we looked at a lot of the different issues. And one of the issues would be whether or not they could get care for their particular need. So if that was infertility, this is why there were so many people with out-of-pocket expenses. A lot of these services are not always covered by healthcare or by an employer. And so many of these families pay out of pocket for these expenses. And there's also things that I had never realized myself till we started reading all of the qualitative, there was one family that mentioned they went through IVF treatment, and when they PCS from the West Coast to the East Coast, they weren't able to bring their embryos with them because they couldn't afford that, and that wasn't part of cost that's provided for relocation. And so that in and of itself was very telling that not every piece is going to be covered that you need covered. And so the other piece of it is there are families who are stationed in remote locations, and those families don't have as much access. There are only, I believe, 6 military hospitals that cover fertility treatments. And so that also, and then when you're talking about adoption, a lot of families want to adopt. And when you move from state to state, just like the mental health providers, they are all licensed. They all have different rules and regulations from state to state. So if you start an adoption process in one state and you PCS, that whole thing stops and you have to start all over again. Some families mentioned they want to foster to adopt. It's one of the ways that people adopt. But if they live in base housing, you have to get special permission for a non-family member, which a foster child is considered a non-family member, to stay in your home for more than 6 months on the base. And so that's another step. And then by the time you get that and then go through that and you PCS again, then you definitely run up against that issue of, okay, now we're in a different state. Now we have to ask again for permission. Now we have to start this process again. And that is a lot of money as well.
It's interesting, Kim, is that as I've done more and more work with families, military families, what I have found as a cohort group, and this, I have no data on this, just been my experience, is that the military does more adoptions than the civilian side. And I think that's true. And I have a very good friend of mine, you guys may know Lisa Howard, right? Who was an adoptive parent. And Lisa and I've talked a lot about this. It's interesting, the adoption process in our country can be so challenging. It's actually easier to adopt now somebody from a foreign country than it is internally with us. And I'm not sure that's good or bad. It's just what it is with that. So, and I think you point out, really, we have such a big need for foster care parents. I think military families want to serve and open their houses up, homes up to foster care. And when they're on base, you're right, it can be very, very difficult. And with command switching every 2 years, what's acceptable one time may not be acceptable next week. So I appreciate that, bringing that up. I want to ask a question, and I was looking for this, and is there a lot of PCSing, right? Is there a move? Is there a number, 3, 4, 5, 6? Is there one where it's like, you remember the movie A Bridge Too Far? Is there a PCS too many? Is there a number of days away from home too many that you guys found in the research that impacts health?
That's a very good question, and one that we often ask too. We did find, looking at the modality and the thriving in school and the school changes, that 5 seemed to be sort of a magic number where things were a little bit different. However, one of the things about military families, and I think our speaker from USAA yesterday mentioned it, is military families are very resilient, and you do these things over and over again, and you start to learn ways to cope with that or to adjust with that. And so there must be another sweet spot on that other end where you have done this so many times and you know you can do it, that the resilience builds. And so then it starts to go the other direction. So we would need a lot more data. We need a lot more people answering our survey so that we have a lot higher ends, so that we can then slice and dice it into the number of moves, how many, what the mental health, all of the different pieces that are going together, would be able to look at it a little bit closer in that regard.
We got some other questions up there coming in at all?
Yeah, let me bring some in for you.
Yeah, thank you.
Megan has asked, did you look into access to mental health care for spouses and children? Spouses and children. I know we talked a little bit about the access to mental health care issues for children, but she asked about spouses as well, access and availability. Are families able to access the care that they need, or are they still finding long waits and limited providers?
Yeah, we are still seeing that family members are waiting a long time, and sometimes it's just that there's not somebody in their area who can provide the care they need. And so that is a struggle. And then of course, coming off of 2 years of a lot of lockdowns, that also has backed that number up a bit too on the wait list. And again, talking about licensing and different laws state to state, if you PCS and you go to a different state, that's starting all over again in that process of waiting and then trying to get into the system and finding the right provider who is within the military system and will be able to take more patients.
It's interesting, Dr. Hunt, when you said that, I was reminded of, right, we're on the airplane and they say when the oxygen thing, mask comes down, put yours on first before somebody else. And that, while we talk a lot about children, really it's we need to take care of the spouse at home and as well as the one being deployed, is that focusing on their mental health is probably one of the best things we can do for our children's mental health.
Absolutely. And we saw that there was a moderate correlation between those two, right? That when the children are having a hard time, the parents are also having a hard time. We don't know if that's what direction that takes, but there is a correlation. And yeah, that's one of the reasons too, we looked at spouse wellness, and we have an entire finding on spouse health and well-being, because they are the person at home and they are the person who is helping the child through whatever the child is going through at that particular time. And Dr. Strong, our expert on this piece, do anything to add anything to that?
No, I was going to add another question that we had gotten that's related to this, and it's about telehealth. I know we talked a little bit about telehealth in the previous data deep dive, but I wanted to ask, just to open up the conversation about why we're finding telehealth doesn't seem to be solving the healthcare access problem. We are still seeing access to healthcare, especially mental health care, as an issue. And why do you think that telehealth is not solving this issue?
We can't give a definitive answer, but we can certainly tell you what we're hearing from our respondents. And what we're hearing from our respondents are things such as, it's very difficult to do some of these things telehealth-wise, especially if we're going to talk about children again for a minute. If you're talking about children who are trying to do occupational therapy over a computer screen, then it's very difficult for them to sit in front of that screen and listen to the person and follow the directions. And if you have also a spouse who's at home trying to work and take care of other children, and that was also something that we heard from people. We also heard that there are some limitations to what sort of care will be paid for or reimbursed when it's telehealth versus in person. We have some people who just aren't comfortable with technology, or maybe they live in remote locations where their technology is not always reliable. And so those are all issues that come up with telehealth. And I think also it was it's not new, telehealth isn't new, but the amount that was being used during COVID is new. And it also takes a while for people to become acclimated and to normalize some of these pieces as well. And then again, moving from state to state as well. Even if it's a telehealth appointment, you cannot keep that provider. You have to move to a new provider. And so there's multiple. And then there's also a lot of mental health professionals who prefer in person as well too.
Yeah, I want to add on to that and note what somebody has said, what Andrea is saying in the chat, that telehealth is hard for kids. That was when we asked about the reasons for not receiving treatment for parents who wanted their child to receive mental health, but they weren't. The top reason was because they didn't think telehealth was going to be effective. It is hard, especially if you're a parent who's trying to really limit screen time, and then you limit screen time, but it's okay if you're doing a telehealth appointment. It can be really hard for some kids, as Dr. Hunt mentioned, like some types of therapies are just really difficult to do via telehealth, and some it's just not appropriate for some other types of disorders or conditions that kids have. I know kids with ADHD have a difficulty focusing, and if they're trying to focus on a screen or focus talking to a provider for a period of time, that can be really challenging to keep them engaged in that treatment for a little while. So it is a great solution for lots of things. It is not the solution for everything.
Absolutely.
It's a very good point, Dr. Strong. One size does not fit all. And in fact, each one of our children and families are unique. And while we talk a lot about our generalizations for military families, one of the things that when you know a military family, you know a military family. And right, we understand the stressors and how they can have on that, but every family brings some their own strengths and resilience. But I think what this last 2 years has taught us is that we can only absorb so many body blows. And it hasn't been that, it's just been one after the other. And now what we're going through now with Ukraine, and I think that has to be big on everybody's, and we did not talk about that today, and we probably may have hit on that a little bit. But again, there's something we're having to deal with, and frustrating with it, right? All of my kids in the residential center are military connected. All their families are active duty or they've served. And since this happened, we have seen some regression with our kids, and it's been a big discussion for us. And so I think overlaying the data that's come out and what we've been talking about today is our real life of what we're going on now, and the stress that, and then you add on to that double-digit inflation, and it's tough. But the data is important. I think that if Captain Ellenberger is still here, letting her hearing the stuff that's going on and being able to take back to help develop with policy and moving forward. I'm looking at the time. Are we there?
We have a couple minutes yet. We probably could do 2 or 3 more questions, so we can grab some of those.
All right.
Oh, Jessica has asked a good question about the difference between this survey and previous MFLS surveys regarding branch representation and regarding, I think she had mentioned previously, regarding the number of respondents that we have. So Kim, I'll let you answer that regarding the number of respondents, and I can look up some of that branch information, or our team can look it up.
That's great. Thank you. So we have, over the years, had a little bit of differences in our response rates. And this year, as I mentioned, we were really glad to get it a lot more from our National Guard and Reserves over the last couple of years. So we were able to spotlight them. This year, we had a lot of respondents, but this was the first year we did data cleaning for bots. And so we did a really scrubbed data cleaning, and we had to take some out. And so it looks a little lower than we've had in past years. It's 8,004 this year after we scrubbed the data. And so this is something that Blue Star Families has decided that yes, those pesky bots are everywhere and seem to have, sort of multiplied during COVID. People didn't have other things to do, I guess. But we took a deep dive at that, and we also really talked about it with our partners at IVMF, and we came up with some really good solutions for trying to get the data clean. And we are going forward, and then everything that we've done since this MFLS, we are working on making sure to make that data as clean as possible. Thank you for that, Jessica.
I'll add to it real quick. I was really happy to see the more work on the Guard and the Reserve. And I think, the reservists especially, right? With the Guard, at least they have their community family, right? Reservists can be in BF nowhere and get called up, and the family have no resources or no support on that. And I look forward to more research and data on that and what we can do and engage them, and then leverage virtual platforms for that.
I'm glad you brought that up, because we definitely found that remote area, the distance from a base, from those support services. And we've heard from our National Guard yesterday that they've heard us, and they are actually working on some of those things specifically. And they've put some programs in place to help bridge some of those gaps that we're showing in there. The other thing I wanted to mention was resources. In particular, we have an entire finding again on resources. We did last year for deployment. We looked at it in general terms this year. And one of the things that was interesting, and this is more of spouse employment that came up, is this is the first year we piloted part of our MFLS in Spanish. And we had 100 people take our survey in Spanish, which was really great. And we didn't get every question translated because this was a pilot, but one of the things that came up was resources for our Spanish language respondents was different for our active duty spouses than it was for their English speaking peers. And they far and above were interested in getting employment resources. This year, we're going to translate the entire survey into Spanish and see if there are also some, looking at things like access and belonging based on, whether they take the survey in English or Spanish.
I just saw a message there that said that the Chief of the Army Reserves and her spouse have been very focused, and they certainly have. I've had the opportunity to meet with both of them. And Lieutenant General is very, very much on that, and I agree with that. And I think we're seeing the same with the National Guard as we pull them in, and they get to have this discussion with us.
We're hoping that being able to highlight them will get more and more of our National Guard and Reserve families to answer.
And it really seems, I think it's interesting because you look at the priorities, we're a little bit different for each branch. But I think that we'll call it the regular Army, it can learn something from the National Guard. And the National Guard they have the days away for training and deployment. What they don't have is the PCSing. And there's somehow, I think, my encouragement is if you guys can tease out that data, is that the PCSing versus the non-PCSing and the numbers of PCSing, because it also has a financial piece to it as well, right? PCSing is huge. Could be a win-win for everybody. We can save a bunch of money and people can be happier.
Yeah, so let me add, I think we have time for one more question, and it's related to this discussion about active reserves and National Guard. It's from Evita, and she asked how much attention is given related to the stigma of receiving assistance from mental health counselors for active reserve and National Guard. I know this is something we've discussed in the past. I'll pass it over to you, Kim.
Actually, Jessica, I would prefer you to take that question since it is a mental health question. So, Dr. Strauss.
Yeah, that's fine. I got it then. Yeah, mental health is kind of my area here that I love to focus on. I come from a social work background and a mental health sort of background, so I'm the subject matter expert on mental health here at Blue Star Families. To answer your question, Evita, around receiving the stigma of receiving assistance from mental health counseling, I feel like we have made this, and this is my speculation, I feel like we've made quite a leap from where we were 20 years ago, but there's definitely still pieces there. Whenever we ask about sensitive issues, and did you ask for help with that sensitive issue, whether it is about intimate partner violence, whether it is about financial needs, whether it is about mental health, the issue of stigma always comes up, and the issue of confidentiality always comes up. Last year, we looked a little bit more in depth on what are the barriers to care for mental health among active duty and among service members and spouses. And I know not wanting, there's more specific data in last year's findings, so I'm going off the top of my head here, but it was related to concerns about confidentiality. Service members did not want their fellow service members to know that they were accessing care. They had difficulty getting time off work to access care, and also explaining why you need time off work in the middle of the day every Tuesday. That can be hard to explain. So it does still definitely exist. It does exist across active duty, National Guard, and Reserve. I feel like it's come a long way in 20 years, but we still have quite a ways to go there. And with that, we have collected all of the questions. We're collecting all the questions that are coming through in the chat, and we're going to respond to them in a follow-up email. I will pass it back to you, Rob and Kim, to close us out for today.
Well, this is way too short. When I started to read the data, certainly I got my geek on, and it's a lot of questions. But I think, Jessica, what you were saying, there's been a lot of gains made in a lot of areas. And I think the gains get made because data gets put out there, and we have something we can take to the people doing the policy to push it forward. So thank you guys for that. And with that, Dr. Hunt, you got the last word, so to speak.
Thank you, Rob. Rob is from, as we mentioned, the Barry Robinson Center, and this is his second year. Thank you again for moderating the session. You always do such a great job, so personable. Now that you have the data and you understand it, we encourage you to share it help us move the needle. This is why we do what we do. If we can move the needle and create positive changes in our military and veteran connected community by sharing these findings, by letting people know what their respondents are telling us, that is key. That is what drives us every day. And in that vein, don't forget to take the 2022 MFLS survey. It is opening on May 23rd. And as I mentioned earlier, it's also going to be translated into Spanish. So we will have both options available at the same time. And thank you again. It's because of you that this data gets out there, and we hear these great questions that we can hopefully somehow bring into our survey.